So I wanted to share with you some of the principles of wound healing. So whether you're a diabetic or not, and you have a non-healing wound on the lower extremity, your feet, your ankles, your legs, there are some things that you need to keep in mind, especially if you are at a wound care center, a wound care doctor, whoever you're seeing, make sure that all of these principles are being followed so that you can heal and get the best possible outcome. The first thing is, if you're a diabetic, and make sure you are not a diabetic, that your sugars are regularly under 200. Why that's important is because anytime your blood sugars are over 200, the body's system gets very confused. It cannot heal under those conditions. So your sugars must be under 200. The next is you've got to keep the wound dry in the shower. Why is that important? Well, I want you to think about the germs from your genitourinary tract, meaning where you go to the bathroom. Those germs in the shower flow down your legs, and guess what? You're standing in them. The skin is the largest organ in the body. It protects us, or protects the inside of us, from the germs on the outside, from bacteria, viruses, fungus, from the outside. So if you have a break in that skin, you can get an infection. Have you ever gotten just a little cut and it's gotten quite inflamed, or perhaps it's gotten infected and you had to apply Neosporin or triple antibiotic ointment on it? Well, imagine now if you had a non-healing wound on the bottom of your foot or on your ankle or leg. So how can one keep it dry in the shower? Well, baggies don't work. I wanted to show you what we actually offer in the office is this shower boot. What's nice about it, it's a strong, good quality vinyl. It has this rubber ring that's quite easy to open. You stick your foot inside, you take your shower. Maybe you want to sit on a shower chair or seat to be safe. And once you get out of the shower, dry this off, remove it, voila. Everything's nice and dry and safe for your wound. The next thing is you don't want pressure on the wound. So why? If I were to cut my thumb open and here on the windowsill, I kept doing this, would my thumb ever heal? No. So why do you think a wound on your foot will heal without removing the pressure? So one of the things we do offer is this really nifty, what we call a peg insole. So if you look closely here, these little hexagonal pegs come out where your wound is. So what we do here in the office, and we can get these ordered for you, is we actually put a lipstick mark as to where your wound or callus is. We have you step on this, and then we remove the pegs, put this in your shoe so you can actually walk without pressure on the wound. Now, this is just one of many, many, many ways that we remove pressure from the wound. It depends on where your wound is and how severe it is. Sometimes wounds that are on tops of toes, we use various paddings to remove the pressure. Sometimes we have to alter the types of shoes you wear. It just depends on the wound. The next thing is blood flow. So every patient of mine that comes to the office, that's one of the first things we're evaluating right here in the office is blood flow. Remember, blood is liquid life, right? That's what gives oxygen to your tissues. Well, many times as we age, blood flow can be a problem, especially if you're a diabetic. If you've got kidney disease of any kind, you're on dialysis, blood flow can be an issue. So we've got to get blood flowing to that wound, otherwise it's never going to heal. So make sure that that gets assessed. The next thing, going back kind of to the showers, free from infection. So if you see a lot of redness, if your wound is draining heavily, if there's a lot of heat surrounding the wound, those are all signs of infection. So you want to make sure it's infection free. Once you have a lot of bacteria in the wound, all healing stops and it can actually reverse and make the wound worse. And then lastly, that wound, otherwise it's never going to heal. So make sure that that gets assessed. The next thing, going back kind of to the showers, free from infection. So if you see a lot of redness, if your wound is draining heavily, if there's a lot of heat surrounding the wound, those are all signs of infection. So you want to make sure it's infection free. Once you have a lot of bacteria in the wound, all healing stops and it can actually reverse and make the wound worse. And then lastly, we want it free from any kind of dead tissue. So that includes scabs. So be careful, because sometimes I've had patients come in, they've been seeing somebody else, there's a scab on the wound, the scab was never removed, and guess what? Hiding under the scab was a wound. Skin cannot grow over dead tissue. Make sure you understand that. Tissue, even deep tissue, and skin cannot grow over dead tissue. You must have healthy tissue in the wound in order for good tissue to grow, in order for the skin to grow over the wound. So scabs must be removed when you have a history of wounds or you have neuropathy or circulation problems. And those are my principles of wound healing.